through. And so she's a great example. Plus, she gave permission for me to use her images in my courses. Just to say, I do use lots of case study, lots of images of my patients. All of them have given consent for the images to be used because it is a good example of, real people. Very important. Okay, so who she is. 63-year-old woman. She had a single mastectomy 1 year ago. She had a series of post-op complications that have led her to a very challenging healing experience. As I said, Maya is not her real name. She's a representation of many women's experience. So for you, I want you to think maybe she could be your loved one, your friend, your client. And in your handbook, you've got your blank treatment plan. So here you can fill in the client information section of the blank treatment plan. 63-year-old woman, single mastectomy a year ago, a series of complications, and you can fill that part in. And excuse me, I'm getting over COVID, so sometimes I may need to just blot my nose a bit. Hopefully I don't cough. Okay, in your handbook here, she faces challenges in 3 main areas. So you can be filling this out as you go along. Physical challenges. She is very tight. She's got restrictive scar tissue. She's got reduced range of motion in her right shoulder. Apologies for the extra apostrophe there. Upper body tension, fluid buildup on her lateral trunk. Social challenges. She has this fear of being touched. She's very disconnected from her body. This is when we were starting. She feels deformed. I'm putting it in quotation marks, but those are her words. She feels deformed. She's unable to talk to anyone about her experience. Her husband is a wall rather than a door. He won't look at her. He won't touch her or talk to her about her experience. She's gotten nothing back from him. Her friends think, oh, but your cancer's gone. You're all done that now. They don't understand this is a situation that is ongoing. It's not a one and done thing. You don't just have the surgery and walk away and it's all cleared from your life. It's an ongoing experience. Her spirits are low, but she is determined to carry on. She is used to being the strong one in charge, so she cannot let herself go down. In her family history, she was a parentified child. So she was the one that kept things going. In her current life, her adult life, she's still the one that keeps everything going. So she cannot let herself be vulnerable and receive help. She just powers through. But her state is kind of like a silo. In terms of systemic challenges, she has really limited access to post-surgical resources. There isn't really any guidance to share what she's going through is normal or not normal. She feels very isolated. She doesn't know where to reach out to. She's not getting much help from her surgeons. She's just kind of navigating this blindly and hoping for the best. Okay, so you can fill these sections in the handbook. Challenges in 3 main areas. Now, I just want to give a little warning. There is some graphic medical imagery coming up. And I'm highlighting the fact you must have great respect and care and dignity towards her when looking at her images. Just like anyone, these are real people. These are real things that they're going through. So first of all, what happened? She got diagnosed with breast cancer in the right breast in the spring of 2024. They attempted breast reconstruction, skin and nipple sparing mastectomy, which you will learn about extensively in the certificate course should you decide to go on. Multiple drain tubes. You can see here, she's got 3 drain tubes that are coming out the side of her body. Lots of blood coming out of these ones. Created an in-hospital environment for tissue healing. So it had a lot of lingering fascial restrictions and fluid buildup in the months afterwards. And it was very, very, very uncomfortable. these drain tube sites have actually proven to be some of the most challenging areas for her to live with afterwards. The drains are not kept in for the whole time, but you know, they have really had a long-term effect. So she had her first complication. The tissues did not get adequate blood supply. So you can see here, she was recreated a breast. She did keep her nipple. So this is a skin and nipple sparing mastectomy with an implant inside, but this section did not get adequate blood supply. It's like a bit of a flap here of some kind that did not get adequate blood supply. So it died. So this is black tissue because it's dead. It's necrotic. Another surgery was required to remove the necrotic tissue. And this, when she got an expander put in, which is a device which is designed to get filled with fluid over multiple months so that the skin, the fascia, the muscles can all expand enough to be able to get, to be large enough to have a more permanent implant put in. However, she got an infection, which required the expander to be removed after only 3 weeks and 1 fill. So then she had explant surgery. So this got infected all through here. And then this is when I saw her. She had 3 surgeries in 4 months. The first appointment was 2 months post-explant. The scar tissue was extremely restrictive. It had many deep adhesions and wrinkles and folds. It had fluid buildup on the lateral thorax, which you can see here. Definitely restricted range of motion in her shoulder. She felt deformed and not whole. And there was no one that she could talk to about her experience. I literally was the only person that she could talk to. So I want to just take a moment to look at how deep this scar tissue is on her chest, the lines of tension, how much they're going up across her whole chest. This was so restricted. This was like glue in through here. This fluid buildup was very uncomfortable. Every time she moved her arm, she was bumping up against it. And it was very, 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 very uncomfortable. So I want to ask you, what if this was someone in your life? What would you do? Would you refer her on to someone who knows more? If so, no shame in that. And if you don't have the skills, it might be the responsible thing to do. Would you attempt to treat her, but struggle on with imposter syndrome and actually have a genuine lack of knowledge and skill? Or would you be self-empowered and look for courses to teach you how to do this work so you can become an empowered therapist to help her through? Which one do you think you would do? Pop it in the chat. Or maybe you would do all of them. Yep. It is a very important thing. Yeah. Look for courses. Good answer. So in your handbook, exercise 1, Maya's challenge for critical thinking development. Okay, look at this. I just want to look into the chat here. Look for courses, learn more, courses. Ooh, like it. Ask to collaborate with other therapists and her doctors, learn more, courses, all, probably some combination of all 3. Refer and then look for courses, look for help in courses, powered all 3. Yeah, amazing. Refer her for immediate help, but look for courses. Yeah, wonderful. Grand. Self-empowered therapist. Yes, this is what we look for. Self-empowered. Okay, so I want you to reflect on Maya's situation and write down your thoughts. What physical challenges do you think Maya might face? At the moment, you can put them in the chat and you can afterwards fill them into your handbook. What physical challenges do you think Maya might face? Based on what you have seen, based on what we've talked about so far, based on your skill as a massage therapist, what physical challenges do you think she might face? Restrictions mentally and physically, decreased ADLs, yep, for sure. Restricted range of motion, pain, issues with lymphatics, yep. Basic ADLs, yep. Breathing, yeah, definitely. Range of motion, decreased activity, trouble with range of motion, but not only on that side, the other shoulder, neck, and even into hips as time goes on. So true. It really can have some pretty profound knock-on effects that way. Pain, movement, limited range of motion. Yep. Clothing discomfort. Yeah. Sometimes where the clothing rubs up against, it gets very aggravated. Shoulder restrictions, respiratory issues. Yeah. All these things. Yep. For sure. Okay. How do you think these challenges might affect her emotionally? How would she feel living in this body? What do you think? Pop it in the chat. How do these challenges, how would they affect her emotionally? What do you think her experience might be? Defeated, yes. Isolated, let down, resentful, brain fog, depression, anxiety, frustration, lost. Yep. Lost confidence. Yep. These are all true. Sad, isolated, frustration. Yep. All true. Heartbroken, fear, low self-esteem. Yep. So true. Angry, all these things. She was feeling all these things. Yep. So body dysmorphic. Yep. Loss of womanhood. Yep. Betrayed. Yep. All those things are true. Definitely. My help. Exactly. That's a good question. Where is my help? There's this instinctive feeling like there should be people around to help me through this. And for her, it wasn't the case. However, once she found me, it became the case. And if there's someone in your community who is like Maya, then they can find you and they can get over these very challenging things. Now, what systemic barriers could prevent Maya from accessing care? Pop it in the chat. What do you think systemic barriers could be that would prevent Maya from accessing care? Insurance, medical sexism, definitely possible. Literally no info. Yep. A lot of people have literally no info, not knowing where to go. Yep. Money. Yep. Doctors not referring, cost, knowledge. Yep. All these things, not knowing where to go, no guidance on what to do. Low income, living in a rural area. Yep, for sure. Embarrassment, isolation, don't know who to talk to, lack of guidance. Yeah. So true. This is really a systemic issue in society that's going on right now. So in the treatment plan, I want you to fill in the primary challenges. Okay, fill that in your treatment plan. Primary challenges that Maya is experiencing. Yeah, no help from husband, no money or resources. Yep, lack of qualified therapists. So true. Which is what our mission is at the Mastectomy Guide, is to get a trained therapist across every major town and city in North America and beyond. Especially we're focusing right now, Australia, New Zealand, and Great Britain, so that at least these 5 countries, which are fairly similar in culture, are able to provide the care, and then we'll spread out from there, once we're still getting ourselves established. So one woman show, no kidding. Here is familiar with the one woman show. And you know what? That just goes to show women are so capable. It's really amazing. I need support, care, and love. Yes. Okay, primary challenges. Primary challenges. Okay, next exercise, your role as the bridge, exercise 2. So before we jump in, who here is like, I am feeling called to be a bridge. I want to be this person. I want to make this difference in my community. Pop a yes in the chat if this is you. Yes, yes, yes. 100%. Love it. Yes, 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 yes. Yeah, that's good. Yeah, it's so wonderful. Ooh, 200%. I love it. Yes. Get the 200% in there. Yes. Yes. Oh, I love it. So great. Thank you so much. Oh, this is so great. See, this is why I feel like I was put on this earth, to help spread the awareness and to help recruit people who want to be a part of the solution. Because I was like, society, this is not okay. We can definitely do better than this. Okay, so how do you know where to start? There is so much to focus on. How do you make sense of the process for effective care? And how could your current skills support her recovery? So let's talk about that at the moment. With the skill set that you have, what could you do to help support her recovery? Thinking honestly, what could you do? Pain management? Yep. Lymph? Yep. Be a listening ear? Yep. Increase range of motion? Yep. Reiki, it's a little outside in where I am, scope of practice, but definitely I'm a believer. Fascia release, yep. Fascial work, yep. Fluid, yep. Judgment free, so important. Yep. Calm environment, so important. Decrease accumulation of fluid, assessment, tightness, release tightness, increase mobility, pain management, wonderful. Scar movement, yes. Craniosacral, yep. Ooh, look at this one. Orthobiotomy, craniosacral therapy, lymph and fascia. That's wonderful. I don't know what orthobiotomy is, but it's a great word. Decreased hypertonicity, fascial work, ear for listening. And let's just talk about that for a moment. The creation of a safe space is so vital, like so vital. Think about Maya. She had no one to talk to, no one at home, none of her friends, none of her medical providers. She's going through this immense experience by herself. I was the first person she came across who would listen and talk with her. Our appointments are 90 minutes. Almost all of them are 90 minutes. And often, especially in the beginning, she would spend at least 45 of those minutes sharing what she was going through. And I was listening and providing reflective communication skills, which you're going to learn tomorrow. And that allowed her to start verbalizing what she had been going through. And being a very strong woman who was used to being in charge, who was used to taking care of other people, she didn't let herself be vulnerable. She never cried. She never allowed herself the space to feel what she was feeling because she just had to keep going. But when she was with me and she started talking, her eyes started overflowing. And she was like, oh, what is happening here? And I'd give her a tissue and she'd be like, sorry, I'm just blathering on. And I was like, it's okay. It's okay to, have this release. This is a very appropriate place to be feeling these feelings. I'm not a counselor, so I'm not approaching her like a counselor, but I held space for her. And her eyes overflowed for our first probably like 6 appointments. Every time that she talked, her eyes would overflow. And now they don't do that because she's been able to kind of get it off her chest, metaphorically, and also literally, I would say. And that ability to hold space in itself is so therapeutic. And we will help you learn how to do that in our certificate courses, but we're going to give you a little taster tomorrow. So speaking of safe spaces, what could you do to create a safe and supportive space? With what you know right now, what could you do to create a safe and supportive space? What could you do to create a safe and supportive space? Non-judgment, yes. Listening, holding space, doing the treatments in their home so they feel space, welcome, be kind, listen. Yes, listening and being present, active listening without judgment. Yes, empathetic, nice, gentle touch, no judgment, calm environment, all so important, all so important. Now, also be honest, what gaps in knowledge do you currently have? Remember, you're here to expand your knowledge, you're here to expand your skills. What gaps do you currently have to be able to help this person at the level that you would want to be able to? Pop it in the chat. Oh, I don't know if I have gaps. So I'm here to find out. Excellent. You don't know what you don't know. So true. Lymphatic drainage. Yep. More about cancer types. Don't know how to massage scar tissue work. No knowledge of what radiation does to the body. All of it. Good. Thank you for your honesty. Lymphatic scar tissue work. How to approach scars. Known contraindications. Yes. Very important. Complications. Confidence. Yep. Here to find out what I don't know. Amazing. Scar and oncology massage, scar tissue treatments, lymphatics, oncology. Learn more of all of it. All of it. I want all of it. I get it. Lymph drainage, gaps in understanding about oncology treatments, advanced scar care, lymph drainage. Yeah. So definitely some themes here. Amazing. And these things are really important to learn so that, oh, where to begin? You know what? That's good. I just need to know where to begin. That's what you're doing here. You're getting started on beginning, and that is so, so valid. Yep. Background on surgical procedures and how different positions and processes affect the tissue and follow-up care. Yeah, so important. I had no idea when I started about all the different types of mastectomies that there are. I thought there was one. I just thought there was one mastectomy. Breast is removed. I had no idea what was going on underneath the surface and all the different ways that they can reconstruct a breast. I mean, it's incredible. Like, let's give our hats off to science because they have really learned how to recreate the body in some pretty creative ways, but they're not always easy, for sure. Not always easy. All right. So writing down in your book, what gaps do you need to fill? Things you can do to create safe and supportive environments. Okay, now this is fun. We're going to take a group picture because we want to commemorate the moment. So we've got multiple pages here of people. So Marielle is my wonderful helper. She is hopefully able to capture our images so that we can mark the moment. Marielle,
yeah, there would be 3 pages.
Three pages. Okay.
Yeah. Okay, you can. What do you like to do?
Okay, we're going to do a different thing with each page. Are you ready? So first page, let's do our little heart here. So everyone hold up your heart. And here goes our picture. 1, 2, 3. Okay. Second page.
Okay, got the first page.
Got the first one? Okay, good. Second page, we're going to now turn it into an MG heart. If you've seen our logo, the heart is upside down because it represents breasts. And that sometimes people can feel upside down, but also they're still loving it. So second page, here we go. 1,
3,
2, 3. Okay. And third page. Hope your cameras are on third page. Here we go. Happy hands. This is like, these are my tools. These are my instruments. 1, 2, 3. I love it.
Got it.
Okay. Thanks, Marielle. So fun. So fun. Okay, so let's go into our treatment plan here. So we're going to look at all the different steps of the treatment plan so that you're able to understand the different steps to work through, right? Like the person who put in the chat, I'm sorry, I didn't pick up your name. I just need to know where to start. This is going to help you. Okay, so for all of you, we're here to demystify post-mastectomy care. So it's giving you a structure to follow so that you're able to work with this complex population. First of all, client info. Who is the person? Filled that out already. Maya, 63-year-old woman, single mastectomy. Who is the person? Client info. Secondly, primary challenges. What are they dealing with? You know, they've sought you out for some reason. Why have they sought you out? Step 3, session goals. What do we want to do with her in this instance because it is Maya. If it is someone who is seeking you out for gender affirming care, perhaps they have different pronouns, whatever their pronouns are is what you use. In this instance, we're using her. What do you want to do with her? Session goals. You want to get clear on that. Step 4, initial assessment. What do we look for? Things that we want to pay attention to. How is her range of motion? What is her scar tissue doing? Does she have patches of numbness? Does she have pain? What are we noticing in our assessment? There's lots of different tools for assessments. We're going to go over a few in the course tomorrow. Treatment techniques, effective light touch techniques. How does this create structure and trust for your patient to lay this out so they understand what is coming, what they're going to be working with, what they're going to be receiving, what treatment techniques are good for your body, light touch, easy to perform, but effective, right? Effective. When I first started doing light touch treatments with my deep tissue patients, I wasn't very effective. I didn't really know effective light touch techniques. I was just trying to decrease the stress on my hands. So you want effective light touch techniques. So you want to outline your treatment techniques. There's an order that can make sense for how you apply them. Step 6, afterwards, when they go home care recommendations, empowering clients to care for themselves. Day 3, we're going to be going over home care. Step 7, the follow-up plan, ensuring ongoing results. That's really important because they want to know what's next. How do I keep, moving the ball forward? How do I keep healing? How do I keep heading in the direction that I want to go? So outlining a follow-up plan. How often are they going to come back and see you? How long is this going to last? What can you give to them that will be, a structure that they can get their head around and that makes sense to them? And last, therapist notes. Now, I like to put in there elements of the patient's story because they all have something. This is something I didn't know when I first started this work. Everybody who gets some type of breast and chest surgery, whether it's due to breast cancer, gender affirmation, or even elective breast surgeries like augmentations and reductions, they all have something significant going on in life. People do not seem to attend to their breast and chest area unless they have something major going on in their life. It almost always correlates. Now, when I first started, I just put down mastectomy. Everybody had a mastectomy, and I didn't necessarily record aspects of their story. And then I would look back in their chart and I'd be like, who is this person again? I can't remember. They had a mastectomy, but so did this other person. And I didn't really record the different elements of their story. So then I was like, okay, I need to be specific. What type of mastectomy did they have? And I need to record aspects of their story so that I am following the plot. I'm aware of where they came from. I'm aware of what they're going through now, and I'm aware of where they want to move to in future. So I've got this kind of narrative that I'm working with all the way through. So therapist notes, remembering the patient's story. So with this 8-step structure, you can create a very effective treatment plan that then you can implement and work with going forward. So it's much less complex with a plan. Okay. Treatment plans. Very, very useful. So pop your feeling in the chat about this plan. How does it make you feel to see the plan all laid out like this? What is your inherent reaction? Good. More well-informed, motivated, great, encouraging, helpful, clear, structured, confident, excited, feels doable, motivated, supported, like the structure, helpful, comforted, clear, helps, amazing, easy to follow, ready, wonderful. I love it. Clear, systematized, amazing. Yeah. gives the biopsychosocial needed for true care and best outcome. Exactly. And on that note, there's a newer model which is coming out, which I follow, which is built upon the biopsychosocial model. And it is the biopsychosocial spiritual model, which has really only started being researched in the last sort of 3 to 5 years. And it recognizes the human spirit as valid. It recognizes that we all have that spark inside of us. And 100%, when you're working with this population, you come into contact with the human spirit, like 100%. There is no way people are coming up against their mortality, making major changes in their physicality, like with the gender affirming surgeries, that you do not come into contact with the human spirit. You absolutely do. So there's now a scientific model which is recognizing the human spirit is real. It's the biopsychosocial spiritual model. And that is what we work with. And the other thing that I love is that it not only recognizes us attending to our patients or our clients, whatever terminology you use, in that way, recognizing their whole person healing, but it also attends to us as therapists. It recognizes what we bring to the table matters. What we bring to the table is influential for the healing process because it is a co-creative process. We matter, our patients matter, and what we both bring to the table is influential for what the outcomes are. So that is the biopsychosocial spiritual model. Yeah, amazing. Yes, fully holistic model. I know. Way back in the day, science was like mind, body, soul. It's so woo-woo. What is that? And now science is like, oh, actually, there is validity in that. And now, they're like actually creating structures around it, which is cool. All right, treatment plan. So by the end of this 3-day course, you will have all of these components filled in your treatment plan. So today we covered the step 1, client info, step 2, primary challenges. I believe tomorrow we're going into session goals, initial assessment, and treatment techniques. And then day 3, we're doing home care recommendations, follow-up plan, and therapist notes so that you'll have an understanding of how to work with this population based on Maya herself. Now, of course, you're probably, when you're wanting to apply it to real populations and real people, you're like, I need more training. We're going to talk to you about it tomorrow. What are your options? How can you enter into our program so that you can get the training that you need? Because we need bridges everywhere. How many of you know someone going through breast cancer? How many? Pop yes in the chat if you know someone going through breast cancer. Yes, yes, yes. How many of you know someone going through gender affirmation surgery? Yes. Yes. How many of you have known someone who has gotten a breast augmentation or a breast reduction or a breast lift? Yes. 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 So this is a global thing. Like people everywhere are getting these surgeries and there is really little to no care. So we are changing the narrative. Changing the narrative. Okay, so let's talk about gaps in care. Why aren't more therapists trained in this? This is really important. Why aren't more therapists trained in this? What do you think is the reason? Pop it in the chat. What do you think, why there are these gaps in care? No info from the physicians. This is true. It's not really their wheelhouse. Like they have a very specific job to do in this whole process, but rehab, it's not really their wheelhouse. They don't really know. And so they actually need some educating on what is possible. And the more that we can collaborate with them and share our knowledge and why this is useful is better, because then they get to understand. Too intimate. Yes, definitely a thing. Breasts, people are like, ooh, private part of the body, do not work on that. Intimidation, absolutely. Lack of training, cultural issues, lack of funding, previously taboo, still, taboo in a lot of ways, but we are definitely working to change that narrative. Unaware that it exists. So true. I cannot tell you the number of times I have heard, I didn't even know that was a thing. It is. And I'm like, it is. It is a thing. Yes, it is. Emotional support, intimate area, still a taboo subject. Fear. Yes, let's talk about fear. Fear of hurting someone, fear of doing the wrong thing, fear of saying the wrong thing, fear of coming across in a way that you're not intending to. Like, people are like, how do I talk about this without coming across like Merv the perv? Like, I don't want to come across like I'm totally inappropriate. I want to come across as someone who's ethical and professional and, can offer good help. Yeah. Lack of understanding, not enough research. It's scary. So hear you on that one. Lack of training, lack of knowledge, lack of understanding, regulations. Yep. Some places are like, can't do breast work. Some places are like, as long as it's medically indicated, it's okay. You have to check your jurisdiction, but a lot of places will allow medically based breast massage, provided it has a medical reason. It's okay. Some places like BC, it's liberal, you can just do it. It's okay. But it has to be indicated. You can't just kind of like randomly do it. Like, hey, surprise, guess what? We're doing breast massage today. And they're like, what? Like, you don't want any surprises when you're working with this population. Everything has to be crystal clear, crystal clear. Yeah, might be more reactive than a typical treatment. Yep, it's true. Lack of specific training, lack of knowledge. Yeah. So all these things are very, very, very true. So let's do an experiential exercise here. I want to do a little visioning exercise. So this way you are able to kind of get a sense from Maya's point of view, what it might be like to go through this experience. And then also as a therapist, what might this be like to go through? So I want you to just put down your pens and your notebooks for a moment, make yourself comfortable wherever you're sitting or lying, or if you're like me, standing. And be prepared to kind of go inside and visualize this experience so that you're able to kind of get inside this, process, this person here. So imagine that you are Maya. All right. So just take a few deep breaths. Put yourself in her shoes. Imagine that you have this complicated healing going on. You're seeing your skin turn black, which is scary. You're trying to navigate that. You're willing to undergo another surgery, and then it gets infected. And so you go through another surgery. You're looking for help, but you don't really have any guidance on what to do. The healthcare team, it's not really illuminating how to navigate this, what she should be doing for herself, for yourself. Imagine what this feels like in your body. You've got this immense experience going on for yourself. This is your primal part of your body. Your breasts are very intricately related to your sense of femininity. One of them is not there anymore. So now you feel lopsided. You feel deformed. You're watching your body become more and more compromised, but you don't know what to do. So there's this sense of helplessness. There's no friends or family to talk to. No one is there to recognize what you're going through. No one is there to witness. Your most intimate partner won't look at you, won't touch you. You're trying to carry on with a brave face. Nobody sees your tears. Even you don't see your tears. Feeling very isolated. Feeling like there should be something there. I feel like there should be something there, but there's just not. And then you come across a name on the internet. Oh my God, there's a therapist who can do this work. Oh, I feel kind of weird about this, but I'm going to book myself in. I have no idea what to expect. I'm just going to do it. There's somebody who knows what I'm going through. And then you go into the room and you find it caring and welcoming. And this person sees you and hears you, will look at your chest, will put their hands on it after you've given permission, is not scared by it, is interested in helping you, wants to genuinely make a difference in your life. And you know, this is a place you can go to move forward. This is a place where you can go to heal. How does that feel? Okay, pop it in the chat. How does that feel? Relief, safe, empowering. Yes. Gratifying and hopeful. Happy tears. Yes, there is hope. Light at the end of the tunnel. Overwhelming. Heart lighter. Thank God. I hear you. Freeing. Release. Hopeful. Yes. Less isolated. Like a weight lifted. Absolutely. Want to cry. I hear you. Happiness. Relief. Gratitude. Yes. Exactly. So, do you want to be that person for the Maya that lives in your community? Yes. 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 I love it. Look at all the exclamation points too. Amazing. Yes, definitely. 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 Okay. Now, let's think about going forward. How could this niche work transform your practice? Think about this. How could this make a difference in how you show up for your work? Lindsay says, holy, I was sobbing there. Yes, I really understand. So what could this do for your practice if you are able to open up to be that person in your community? You are that person. What could it do for your practice? What could it do for your body? And remember your big why. Okay, let's tune into your big why. How could learning this work support your big why? Help more people? Absolutely. What would this do for your practice? Help me do more meaningful work? Yes, absolutely. I would feel more empowered, more confident, more able to help a certain demographic. Scared of losing what I have going, but encouraged that my work could have more meaning. Yes. And you don't have to make a transition right off the hopper. Like I'm 100% this population. You can have a portion of your practice helping this population, or like me, over time, you could build it so it became full time. Or some people like a mix. They just want to be able to help this population. They want that skill set. They don't want to be shut out from it anymore. Longevity, bridge, build a safe haven, feel valuable. Yes, help women who don't feel supported up to now. Longevity, change for how I see people in a helpful way, create a safe space for others in healing, help an underserved group, helping others that otherwise have nowhere to turn. Amazing. Help clients who need this type of assistance, provide them with more education. That's a really good one because sometimes they're faced with these immense decisions that they have to make under a very short period of time with extreme emotional duress and really not much information. So you can be that person providing information. Ooh, want to open a wellness space specifically for LGBT folks. Nice. Safe spaces contribute back to the community. Yes, your community needs this. Yeah, just want options and helpful work. I hear you. Want to have more fulfilling work and to help be a part of the community that has very little. Yeah, be a reference. Amazing. So these are all things which are really, really important and really can make a huge difference in her, in your community, in your practice, in the life of the person in your area who is Maya, who is right now searching for someone there must be something, except I don't know where to turn. I don't know where to look. And if you decide our certificate programs are for you, we will help you learn how to do that. And we're going to share more about that tomorrow. Okay, now we've got an activity for you to do. Those of you who have joined our Facebook group, this is where the activities are taking place. If you have not yet joined the Facebook group, Marielle just put the link in the group to participate. So it's in the chat, the link there to join the group. You will need that. We want you to share in the group, what is your big why for getting into this work? What is your big why? It's really important to ground into your central sun, right? You need that spark inside of you that all this can revolve around. And that is what creates the momentum to keep going. Even if you come up against things that are, causing you to move past your comfort zone, past what your limitations are, you need that central sun. So we want to anchor you into your big why. And add a selfie so we can see you and celebrate you. So we want you to share your big why and your selfie, and then like and comment on 3 other people's posts, because as we have seen today, being seen, being witnessed, and being validated is extremely therapeutic. And because we follow the biopsychosocial spiritual model of care, where not only we're attending to our patients, we are also attending to ourselves, we need to be seen and validated as well. So we want you to like and comment on 3 other people's posts as you share your big why and your selfie. Okay. And this is going to be up in the group so that you can find it. And then tomorrow we will be getting into assessments and some clinical skills. And then, of course, the training opportunity that's there for you. And tomorrow there is a bonus just for people who are live, an extra period of time after the course, half hour for hot seat coaching. So if you have patients that you're working with that you want help and support with, and you want to talk it out with me, then you have that opportunity for hot seat coaching. And it's only for people who are showing up live. So you must be there in the room. It's not going to be shared as a part of the recording afterwards. So you do want to be present in the room for this coaching so that you can get your questions answered. If you have patients that you're currently working with and you're like, I'm challenged, I need some insight, I'm here for you. So that is tomorrow. And I'm looking forward to it. So pop a word in the chat right now. What is your most dominant feeling as you are leaving day 1, wrapping up day 1? What is your feeling here? Inspired, excited, encouraged, excited, inspired. Definitely noticing a theme here. Hopeful, excited, yay, great session, curious, building a plan. Yeah, you are. Motivated, positive, excited, wanting to learn more. Love it. Impressive. Thank you. Motivated. I love it. Thank you so much. So feel great that you are co-creating this super positive experience. Bring this good mojo out into the world around you. Invested. Love it. And we will see you back here tomorrow. Same time, same Zoom link. And thank you so much for being here. Ciao for now. Cup is filling up. Yeah, baby. Yes. Thank you so much. See you tomorrow. You are so welcome. See you tomorrow. Love it, love it, love it, love it, love it. You are so welcome. So welcome. Yes. Have a wonderful day. Handouts came in your email. You should check your email. And if not, you can email info@mastectomyguide.com and Marielle will email it out to you. Oh, there she goes. Download the workbook. She's so on top of it. I want to do a shout out for Marielle. Marielle is just the greatest person to work with. She is so helpful. She understands the business. She's on top of things. She is like so great. This is a team effort. Thank you, Marielle. Okay. Ciao for now. Yeah. Yay for Marielle. Yeah, for sure. Team effort. Teamwork makes the dream work. Yeah, it sure does.
The recording has stopped.